A lack of inspectors, a whole sector unregulated, and a long wait to license more facilities. Those are just some of the problems plaguing long-term care in Hawaii, and it could be putting Hawaii's elderly at risk. Gina Mangieri is always investigating and tells us what she's found. Gina?
Joe, when I started digging into what many have called an elder care crisis, I found a slew of problems with regulating the industry. So we asked, what will it take to fix it? And I found out some things are in the works to address the issues.
These kupuna at a Windward Oahu Elder Facility are among the nearly 12,000 people in Hawaii who have found long-term care in the face of a severe shortage.
They can't find a bed available. They need home care immediately. So I think for the majority of the public, they don't realize until it's too late.
Far more than that are needed, and the Department of Health is in the middle of all this. They have to license and they have to inspect.
Yet despite long wait lists for places like this, the state agency that regulates the industry puts new inventory on the back burner.
Those brand new facilities who require an initial survey are the lowest priority. And unfortunately, as a result, those facilities will have to wait until we have the resources available.
A wait, he says, can be a year or more. And as for the hundreds of existing locations with a license, a severe shortage of inspectors has them triaging those inspection and relicensing visits too. Only places like skilled nursing facilities stay absolutely within their annual licensing visit timeline. That leaves a gap for many places like Hawaii's nearly 500 adult residential care homes.
Those are in the scores, 60, 80 in that neighborhood where we're behind. And it equates to approximately 10 to 15% of the facilities.
What happens when they hit an expiration date?
We don't revoke or cancel a license. What we do is we get out as soon as we can. If necessary, we'll extend a license. We don't want them to have to kick out, mom and dad and grandpa.
If you can't get your inspections done and you're way behind, there could be a gap in time where maybe somebody did have a bad outcome and they shouldn't be providing care any longer. So it's yet another reason that we want them to be caught up in almost real time.
The state is filling one inspector vacancy at the end of this month and recruiting for a handful of new positions that could start as soon as January. But that's half the battle. The other is knowing exactly where to start.
When I asked you about the list of who was expired, it's not easily accessible to the public or to you.
Right. It's not a list that we necessarily maintain. It's a paper log, essentially. And not even a log. It's just a file where we've kept copies of licenses that we've issued, and we go through and see when the license is due for renewal. We need to create a management information system where we have databases of providers and we can inquiry reports.
We can't get safe services to people if we don't get these certifications done.
Senator Josh Green is also an ER doctor. He sees the problem up close.
Elderly woman cracked her pelvis, and she came into my ER late at night on the neighbor islands. We had nowhere to send her. We would love to have home nurses, but we're short of all of these services.
Short, partially because the regulatory backup goes beyond just center-based licensing. Home health care, nurses that come to your house, are a huge part of this sector. Home care aides, helpers but not to a medical level, often help patch the remaining gaps, but they've been in limbo for years despite a 2009 law requiring the state to license them.
There's just not the same standards, universal standards for protection of our consumer and, most definitely our kupuna.
What's the status of regulation for home care? Why did it take so long?
Well, we have a number of other things that we're working on as well.
Other things like getting a cannabis dispensary system underway.
Did medical marijuana licensing and the preparation for that take resources away?
It didn't take away inspectors from our current staffing, but there's a tremendous amount of infrastructural support that had to go along with that.
He says the department is finalizing draft rules and is weeks away from submitting them to the governor to go to public hearings. They'll be proposing a fee for all licensees to raise under $500,000 a year to cover a data system, and the rules will finally get home care licensing in place.
After that, it'll become the enforcement. How are we going to do that with our current resources?
How are you going to do it?
Well, we can't. We'll need to get the support of the legislature in order to provide funding.
Lawmakers say they'll back it.
I want to offer or encourage extra positions going forward for next year so that they can never be very behind. Until then, they know that they're up against the wall.
So when places finally do get their annual inspections, how transparent are the results? I'm digging into the reports to find out the most common violations to watch out for. And I'm asking, what's with all of these blackouts? That's coming up Monday. Gina Mangieri, KHON 2 News.